Patients with aging face changes generally have more than one thing going on. And the common things that we see in the aging face are, number one, that the facial tissues sag, and that's what gives you folds, sags, and bags. But we also see that the facial tissues tend to deflate a little bit. In our aging face procedures, while we commonly think of the lifting procedures that we do, it's important to also understand that for many patients who have more severe volume loss, that correcting and restoring the plumpness over the cheeks, the volume of the brow, the volume in the temples, the volume along the jawline can be a very important part of their rejuvenation procedure. Often when we're doing these patients in a surgical fashion, it makes the most sense to use fat transfer to accomplish this. Using modern transfer methods, we can move fat from the belly or from the flanks into the face and obtain a 90% or so retention rate for that fat over time. This is a way, unlike fillers, that we can restore volume that then lasts over years rather than over the course of several months. So if you're not yet familiar with the fat transfer procedure, we're happy to explain it to you. Please come in and see me for a consultation, and we can discuss whether this is a procedure that will be helpful for you.